Welcome to Colonie TV, the governmental educational channel for the town of Colonie.
Hi everyone, welcome to Health and Wellness. My name is Drezelo and I'm your host for this program. Today we're going to be talking about naturopathic medicine, what it is, what some of the benefits are, as well as the relationship between it and traditional medicine and doctors. So to help us talk about this, we have today Amy Cole here, who is a naturopathic doctor. She's licensed in the state of Vermont and she has offices in East Greenbush as well as in Bennington. So I want to welcome Amy Cole to our program today. Hi, Amy.
Hi,
how are you?
Great. Thank you for having me.
So why don't we start out with a little bit about your background, what it is a naturopathic doctor is, why you came into the profession, the licensure, educational requirements, training, etc.
Okay, great. So I first got interested in naturopathic medicine actually when I was in undergrad. I went to Hartwick College in Oneonta, New York, and I was studying psychology and chemistry and biology as minor degrees. And I knew I wanted to go to medical school of some sort, but my ideas about what I wanted to do in medicine were a little bit different from what we're used to. I knew I wanted to focus on preventative medicine and looking for underlying causes. And in having some health problems of my own, I sought out an herbalist and was describing to her what my idea of medicine was. And she said, "You're describing naturopathic medicine," which I had never heard of before. So this was all new. And I had immediately gone home and researched it and said, "Oh my goodness, this is exactly what I've been looking for." And so switched my whole gear. Still had to go the pre-med route since that's one of the requirements for naturopathic medical school. Applied to the University of Bridgeport College of Naturopathic Medicine, and that is in Bridgeport, Connecticut. It at the time was one of 4 schools in the United States. Now there's 5 schools that are accredited for naturopathic medicine, and went there following undergrad. So the education of naturopathic doctors is similar to conventional doctors, such as MDs and DOs, in that we have 4 years of postgraduate training that consists of basic sciences. We do get pharmacology as well, like the MDs, but in addition, we also get extensive training in nutrition, as well as other modalities, complementary modalities such as hydrotherapy, homeopathy, herbal medicine, physical manipulation, and so it's a little bit more of a well-rounded medical school where we get exposure to different areas.
So what about the licensure in New York? I know you have offices in Vermont and in New York, and I believe Vermont has a licensure program for this type of physician, but tell me a little bit more about us.
Yeah, so naturopathic doctors are licensed in 16 states in the U.S. and then also in Washington, D.C. and Puerto Rico and the U.S. Virgin Islands. And actually, within the past couple of weeks, Maryland got added on as well, so that would be the 17th state that will be licensed. New York does not offer licensure for naturopathic doctors. Vermont is one of the states that does, and so in Vermont we're considered primary care providers there, so we can do all the typical things that you would think of with conventional doctors. You can do physical exam, you can diagnose, order lab testing, and even order pharmaceuticals as needed. We do have a limited formulary which is going to broaden out next year. And so in New York, since there's no licensure right now, we're not considered physicians in this state, so we can't diagnose or do any type of testing. So what I do here is I would offer naturopathic consultations. And so that means that we work with patients who have been to their MDs or DOs, gotten their diagnoses, have started some type of protocol with them, and they want to add us on as in conjunction with what they're doing.
So what type of conditions or problems would someone specifically go to someone like you for versus I need to go to the doctor because I have whatever, a back problem or what? Just tell me some of that, like why would you see you versus going to a traditional doctor? What would be some of the...
Yeah. Well, that varies for people. I see quite a bit across the board from acute things like, somebody comes into me in Bennington for an ear infection, I can diagnose and treat that there. In New York, it's a little bit different because of what we're limited to do. I usually end up seeing people who've been chronically ill for a long time with different things. So diabetes, I see a lot of, as well as hormonal disturbances. So that could be menopause for some women. It could be polycystic ovarian syndrome that they're struggling with, infertility. And so it's pretty wide, range, hypertension, cholesterol issues. And so we see quite a variety of things.
Do you ever, when someone comes to your office, do they usually start at the doctor, then come to you? Or if they come to you first, do you ever advise people to also go to the doctor at the same time? Or do you treat people by yourself necessarily? Or how do you go about that?
Well, most of the time in New York State, people are most of the time in general, whether that be New York and Vermont, I'm always the last resort for people, it seems. So it's like they've tried everything else and now they're searching for something different. And so that happens quite a bit. I very rarely will get a phone call from somebody who has not seen a regular doctor. And in New York, I advise them off the bat, they absolutely need to see an MD or DO here because you need to have a physical exam every year. You need to have blood work done. And so I do advise them to do that in New York State, absolutely.
Is there any specific conditions that you yourself have had a lot of success with treating yourself either in Vermont or in New York that you really kind of hang your hat on? Yeah,
I think one of the biggest things that we get as naturopathic doctors in general get great results with are things like fibromyalgia, so people with chronic pain conditions, type 2 diabetes. Most of that we can really deal very, very well with through nutrition and through different herbs, as well as hormonal imbalances. So I see this with a lot of women that I'm the last resort for things like polycystic ovarian syndrome or infertility. And there's a lot of complementary medicine out there that can really assist people with those things. And so we do get great results with those.
What about some of the modalities? When I think of naturopathic medicine, I think there's a lot of things that could fall under there, like acupuncture, vitamins and supplements, and there's just 100 things you could probably think of. But what are some of the modalities, and some of the more common modalities anyway, that you use, or you might tell someone to see another provider for, things like?
Yeah, so every naturopathic doctor sort of resonates with a different modality one more than another. But I would say, for the most part, most naturopathic doctors include nutrition into their plans. We also include some type of herbal medicine, so using plants as therapy for people. A lot of times our plans will also include some form of hydrotherapy or working with water. Most of the time those are home modalities, so we'll teach people how to do that on their own at home. And homeopathy is another one that falls in there. Acupuncture is something that would be considered a complementary therapy, and there are NDs who practice acupuncture. Most of the time, those NDs have some other training, so they also have a degree in Chinese medicine and acupuncture. Right. We are exposed to that in school, but most NDs that practice that will have that additional training.
Do you have any other licensed specialties yourself, like acupuncture or something like that? Do you have anything like that?
Nope, for myself, I just have the degree in naturopathic medicine, general naturopathic medicine.
What about, a lot of people wonder, particularly people who haven't been exposed to the field, wonder whether there's any scientific background on any of these modalities or treatments and whether it's safe. Because there's a lot of questions about things because it's not a typical traditional medical practice.
Right.
Tell me a little bit more about that.
Yeah, those are great questions for people to have. There are definite research studies that have been done more specifically with herbs than a lot of the other modalities. naturopathic doctors in general, especially through schooling, we really strive to be trained in research-based medicine, meaning that we really try not to use a lot of modalities unless we have some type of evidence behind them. And if we don't, and it's anecdotal evidence, usually what we'll do is we'll inform the patients that this is not something that has been, has double-blind research behind it, and it is anecdotal. And usually we will only use those if there's, no side effects with them. There are side effects to using herbs. Herbs, I say, are the closest thing to drugs we can get with the chemicals in them. And there are side effects to even nutrients, so even high-dose things like high-dose vitamin A and high-dose vitamin D. And so that's another reason I always say if you're somebody who likes taking herbs, somebody who likes taking nutrients, especially in pharmaceutical doses, it's extremely important that you have a naturopathic doctor to see, because we really understand what medications and herbs can be taken together, which ones need to be taken apart, who can take the herbs, who should stay away from them. And so, yeah, absolutely, there are side effects to everything people take.
What about insurances? In Vermont and in New York, does insurance cover what you do, basically? Do you need a referral to see this? How does the typical insurance process go for New York and Vermont?
Yeah, so in New York, because we don't have a license here, insurance companies are very reluctant to reimburse for the services. I can't take them directly because I'm not practicing medicine here. Some insurance companies have provided partial reimbursement for some visits to patients based on the plan that people have. It's very different in Vermont. In Vermont, because we're primary care providers, the insurance companies are all across the board required to accept naturopathic medicine. So it's very different depending on the state.
There's a statement on your website I just want to read. I just want you to explain it a little bit.
Sure.
It's from Hippocrates, actually. It is more important to know what sort of a person has a disease than to know what sort of disease a person has. So talk about that a little.
Yeah.
It's kind of different.
I think that really gets at the core of naturopathic medicine. So a lot of people assume when they hear naturopathic medicine and what we do that we just use natural therapies to treat diseases, which to an extent is true, but I would say that one of the best things about naturopathic medicine is that we're not really treating the disease, we're treating the person. And so what that means is if I see, 5 patients come in on the same day for menopausal symptoms, let's say, all 5 of those people are leaving with something completely different based on the person, not on the disease. And I love that about naturopathic medicine, that we can do that.
Is naturopathic medicine used primarily for more preventative type measures, or can it also be used to treat really acute type conditions? Basically?
Yeah, I would say preventative medicine is a huge part of what we do. However, we definitely also can deal with acute issues as well as dealing with chronic issues that have been going on for a while. But we always strive to, if we have somebody in front of us that has a, high family history, let's say, of heart disease, that's going to come up in the conversation that we have, and we try to deal with that as well.
So tell me about how you go about treating someone specifically. How long are they there? Getting back to the Hippocrates statement, how do you usually see a person from beginning to end during a visit?
Great question. So typically people will come in and their first visits are about an hour and a half long. And the reason for that length of time is we're really trying to, again, get at the core of the person. So somebody will come in. If we're in New York State, they're bringing in all of their lab work, previous diagnoses, and we discuss all of that. But we also discuss other things. So most people are used to going to their doctor's office and saying, I've got headaches, this is what they're like, and you're out the door with your solution.
Yeah.
Whereas a naturopathic doctor, we talk about those headaches, but we'll also say, okay, what else is going on? Let's talk about every other system of your body. And let's not only talk about physical systems, but what do you do for work? What's going on in your world? How's your marriage? How is your life? What's going on with your moods, your mental emotional state? And we really try to investigate, what's going, the whole picture rather than just sticking with the physical.
When you're in Vermont and you're practicing, where you do have a license, do you ever prescribe or go back to the more conventional treatment, or do you basically typically 100% stick on more of an alternative type approach, or do you?
Yeah, in Vermont, I've gone to the conventional approach a couple of times, usually, and again, I think it comes back to treating the symptoms versus treating the underlying cause. So if somebody comes in and they're complaining of, fatigue and muscle aches and pains and joint aches and pains, and you investigate it and they have Lyme disease because they just had a tick on them, a few months ago, they're going to leave with antibiotics. It's a bacterial infection that they need treatment for.
Right.
And we would probably do some type of herbal antibiotics as well, but mostly, with something like that, we would also give the prescription form. So I definitely would say we do go back to the conventional modalities a lot. And we use them, we try to strive to use them with the underlying cause of the disease. So rather than, let's say prescribe a pain medication, for something that's going on, we may do some type of pain relief in other ways and then jump and use some type of treatment to treat the cause of the problem.
So we started with saying that right now in New York State that you're not currently licensed, unfortunately, but you are in Vermont. So where is the state of licensure in New York over the past several years? Where has it been? Where is it going? Is there any hope that people like you will be getting the licensure that they deserve, or is that?
Yeah, well, I always hold out hope. I've been doing that for years. So far, it's looking good. So far, in the past few years, the vote has come up every year in the Senate, and we've always passed the Senate. And then it gets to the House, and it doesn't come up for a vote.
Yeah.
And so that's where everything gets stalled. But we go to Albany, we talk to all the legislators, and for the most part, everybody is in support of it. And so hopefully within the next few years, we'll see that going through. It's supposed to come up again this year in May, so soon, and we'll see if they vote on it at that point. I think it's an important thing to go through, mostly because, for example, in a state like Vermont where we're licensed, we have different associations for those states that regulate us. So right now in the state of New York, there isn't any type of, we do have a New York association, but there's nothing to regulate naturopathic doctors and make sure that we're following rules and, So I think it's important for safety issues, too, to get licensed.
If it does become licensed, there are actually differences between states that already have the license. Are there different like licensure levels? Like, are some states better than others, or is there like any room there for negotiation? Or like, how does that? Is it one size fits all?
Yeah, so absolutely there are different levels. So for a state like Vermont, our licenses are pretty liberal. We have, pretty wide scope of practice there. Mm-hmm. A state like Connecticut, where we are licensed, is a little bit more conservative in that we're not considered primary care providers in Connecticut. We're considered specialists. So that would mean some insurance companies would require a referral. It would also mean that you can still diagnose, you can still order lab work, but you're not able to order pharmaceuticals in the state of Connecticut. So you really need to work more closely with MDs and DOs in those states to really make sure that your patient's getting well-rounded care.
Where would New York be headed? The Connecticut path or more the Vermont path, do you think? Or where's it been framed
It's been sort of rewritten over and over again. Right now, we're sort of in between a Connecticut and Vermont law, meaning that I don't believe we're asking for primary care status, and I don't believe we're asking for pharmaceutical rights at this point either, but we are asking for the ability to diagnose, the ability to order lab work, and so it's sort of in between Connecticut and Vermont, and we'll see where it ends up.
Mm-hmm. All right, so with that, we're getting close to the end of our program here. Because New York State doesn't currently have a licensure, we just want to read a quick disclaimer. Dr. Cole does hold a license as a naturopathic physician in the state of Vermont, as New York State does not currently offer licensure. In the state of New York, naturopathic medicine is not intended as a diagnosis, treatment, or prescription for any disease, mental or physical, and is not a substitute for regular medical use. That aside, I really want to thank Amy for coming in today and being our guest. And this program will be available on our website shortly, and we hope to see everyone on the next episode of Health and Wellness. Thank you very much.
Thanks for having me.
Yeah.